We've been talking about heart disease and menopause, and one of the big questions that I think is still unanswered, at least for me it is what tests do women get? They often will tell me after they've had a heart attack that they went into the emergency room, they had certain symptoms, and they were sent away and they were told their heart is fine. And what should a woman know when she goes in? What tests should she have done to be sure her heart's okay?
So that's the best question in terms of what I can help answer, because what we know is that about half of women that have heart attacks have what we call open arteries. So the traditional heart attack, and what we've learned as doctors, is that the blockages on the big arteries that sit on the heart are blocked, and we now know that yes, that can happen in women. Women get taken up to what we call an angiogram suite, and they get a dye put in with a wire, and oftentimes if they're blocked, they can open them with stents. Now, if a woman goes into the emergency room with chest pain, we check an enzyme that confirms that there's a heart attack or there's some heart tissue that's damaged. If she goes up to that same angiogram suite, they put in a wire, they push the dye down there, and there's no blockages. That's called an open artery myocardial infarction, or an open artery heart attack.
Mm-hmm.
And what that is signaling, and it should not stop there, and you should not be told it's all in your head, that this is not your heart, and that you shouldn't be patted on the back if this has happened and reassured that it's not your heart. Because clearly there was a signal that it was your heart. And we've learned a lot in the last decade. And that's really that there's microvascular vessels that come off of the big arteries that can be dysfunctional, and that can be your downstream cause of the heart attack. So there are ways to test for that. There's specialty centers. We are one of them at the Barbara Streisand Women's Heart Center. We do a traditional angiogram and check and make sure the arteries are open. But then we do what's called a functional angiogram, which is called a coronary reactivity testing. There are several sites across the country that do this, and that is the gold standard way to test for microvascular disease. Now, it involves putting a wire down into the artery, and instead of looking for blockages, because we know they're open, we trickle down medicines that are safe in this setting, but we want to see the response of the small arteries to adenosine, acetylcholine, and nitroglycerin. And these three medications and the changes that we see both to the size of the flow of the blood as well as the waveforms coming back is what gives us that diagnosis. And then based on which ones were abnormal, we can then treat.
So you actually trickle in medicines that will influence blood flow in the small vessels of the heart.
Yes.
And based on direct observation, you can see changes that either say they're doing fine or they're not.
Right. And they're all calculated changes. At the end of the study, we get our calculators out, we do some diameter checks and flow, write down what the flows were, and then we can actually calculate if the percentage is going in the right direction or the wrong direction. So we can actually quantify it as well.
And then there are things that women can do if they're going in the wrong direction.
Of course. So we do treat based on those pathways. And we use traditional medications that are used for heart disease. But really what's going to help them is if we know what is wrong and what we can treat. Now, there are other heart attacks that can happen in women that are not the microvessels, and that's something that's called, there's Takotsubo. That's a new term that we're becoming more common. You might have heard it as called the broken heart syndrome.
Yes.
But it's Takotsubo cardiomyopathy, and that's a sudden and onset of the catecholamines, or what we call adrenaline release in the heart, and the heart almost spasms. The muscle itself changes shape. The word Takotsubo actually means octopus catcher, and that's actually the shape the heart turns into, and we can see
It's
that.
like a little jug or something.
It's a jug. It's almost like a pot jug, a clay jug. And so that's another type of heart attack that can happen in women that is not from blocked arteries. So there's a lot to be learned about how the physiology or the structure of the heart's different in a man and different in a woman, and then how we go forward and treat that.
Thank you so much.
Of course.